Hello and welcome, everyone. Thank you so much for joining us today. My name is Aiden Dowling. My pronouns are he, him, and I am the co-founder and chief advancement officer here at Point of Pride. We are excited to have you with us for this special conversation, which is part of our Transgender Awareness Week programming. This week is all about uplifting trans voices, fostering understanding, and advocating for greater visibility and access to care for transgender and non-binary individuals. We're grateful to have everyone here as part of this important dialogue. Before we begin, I want to put a disclaimer that the information we share today is provided for educational and informational purposes only and is not intended as medical advice. Please always consult a qualified healthcare provider for personalized medical guidance. I'd also like to take a minute to introduce those who may not know what Point of Pride is and what we do. We were founded in 2016. Point of Pride is a trans-led nonprofit organization dedicated to providing life-saving, gender-affirming support to transgender and non-binary individuals around the world. We offer direct services through programs such as our free chest binder and GAF program, our HRT Access Fund, our electrolysis support fund, and currently open for applications, which I will drop the link when I'm done speaking, our annual surgery fund. Our mission is to eliminate financial and systemic barriers to care, ensuring that every trans person has access to the services they need to live authentically and thrive. So first and foremost, I'd like to introduce our host and guest for today's virtual workshop. First up is our host. Everyone say hi to Slater Nelson, pronouns they, them. Slater has their master's in exercise science and health promotion and is a National Academy of Sports Medicine certified personal trainer and nutrition-based coach in Brooklyn, New York. While they work with clients from many backgrounds, their focus is supporting and empowering fellow queer people of color and advocating for trans equality. Their personal training business, Fitness, centers authenticity, community, visibility, and radical joy. Their passion for movement began in college when they joined their rugby team, and they've been playing and coaching for over 15 years. Thanks so much for joining us, Slater. Next up is our guest, Dr. Mosser, pronouns he, him. Scott Mosser is a board-certified plastic surgeon at the Gender Confirmation Center in San Francisco, California. Mosser specializes in gender-affirming top surgery and body contouring for the transgender, non-binary, and gender-expansive community. He is a fellow of the American College of Surgeons and is a member of the World Professional Association of Transgender Health, also known as WPATH. Currently sitting on the Standards of Care Version 8 committee. Dr. Mosser is the founder of the Gender Confirmation Center of San Francisco and of the Gender Institute. Thank you both, Slater and Dr. Mosser, for joining us here today.
Thank you, Aiden.
Yeah, thank you so much for having us.
Of course, happy to have y'all. So we are here to share some expertise for our topic of top surgery. As a reminder, we will have time for questions at the end of this discussion, so please feel free to ask them in the chat, or there's also a Q&A box. You can drop that at any time. And I also want to thank our ASL interpreters for being here for those who need them. So without further notice, Slater, I will pass it over to you.
Alrighty, thank you so much, Aiden, and hello, everyone. Happy Transgender Awareness Week, and welcome to today's topic, surgery, today's top surgery fireside chat. The fireside chat today is going to focus on top surgery, a gender-affirming surgical procedure that is essential for many transgender and non-binary folks like myself. Top surgery involves the removal or enhancement of breast tissue to create a chest that aligns with a person's gender identity. For F to M, or female to male transmasculine individuals, it typically involves a mastectomy and chest contouring. Top surgery is often a life-changing step in reducing gender dysphoria, boosting self-confidence, and improving mental health. While the surgery can provide great emotional relief, there are some considerations about recovery, expectations, and long-term impacts of the procedure. Our guest today is Dr. Mosser, an experienced provider of gender affirming top surgeries, and he's here to share with us insights from their practice and experiences with patients. So thank you, Dr. Mosser, for being here. And we will jump into some questions if that's okay with you.
Perfect. I'm so happy to be here. I always love to work with the point of pride with anything that you all do.
Awesome. All righty. So let's kick it off there. And let me first ask you, what inspired you to start working with in gender affirming care and what led you to specialize in top surgery?
Yeah, thank you for asking that. I got out of my training in 2004, and I had taken extended training to specialize in cosmetic plastic surgery, and that's what I started to do in San Francisco. And while I certainly think that cosmetic plastic surgery makes a lot of people happy, I actually found that it wasn't as values aligned with my values as I had sort of hoped that it would be. And interestingly, it made me really, really exhausted to do that job. And I don't think there's anything wrong with cosmetic surgery, but when you're not values aligned with something and you're working incredibly hard, it's like double, triple as tiresome, in my opinion. So, about 2008, somebody came in to see me. Remember this individual very well, and he was a very masculine presenting individual. I think he'd been on hormones for about 15 years or so. And uh, when he told me that he needed to have a chest reduction, I actually didn't fully understand. Then he showed me his chest, and it was, I'm sure, very, very inconvenient for him as a very masculine presenting individual. He had had a very large chest. And I had not done any of these procedures before, and I told him as such. Um, but he felt that I was the right surgeon for him, and so we moved forward. And fortunately, not even having done one, I got a really good result. His results are actually on the website to this day as one of my before and afters, so it went well. And I really, really enjoyed my engagement with him. He was a down-to-earth individual. Um, it it just there's interesting in cosmetic plastic surgery, there's an interesting like rift with the patients. There's a distance. It's almost like there's a distrust, maybe partly because of the way society has portrayed cosmetic plastic surgeons, but
Interesting.
it's like there's a chasm between you and the patient. You can never really have a normal bonding experience. But that wasn't true with my trans patient. And then I just thought that he was a great guy. But then after patient after patient after patient, there was an undeniable pattern that the patients were just very intelligent and very down to earth and very focused on a specific issue that I could help them with. And then on the back end of surgery, when surgery was done, they're very, very appreciative in a
Yeah.
normal and incredibly well balanced way. It was a normal human relationship, start to finish. And I just realized that and I wasn't exhausted. I really actually wanted to work harder. Um, so then in 2012, I know it's a long answer. I'm sorry.
No,
Okay,
please.
okay. In 2012, I realized that most people were coming to see me with very deep misunderstandings of what everything was all about. And there was very poor information that was out there. So I decided to build a website around my opinion of the thought process that should go through making these decisions. The goal was to get patients to a point that they were not sort of walking into an office and just having to deal with whatever the doctor spat out of their mouth. They were walking in as a fully informed partner of care and could participate in the discussions and also maybe have an idea of when the surgeon wasn't being reasonable, perhaps.
Mhm.
I think there's a lot of good people in gender surgery now, but I think there was a time back then when sometimes it was the surgeons that weren't very successful elsewhere that sometimes were doing gender surgery. And so I wanted to arm people with good information, created a website around that. Fortunately, that was very, very, very well received. Um, Incidentally, our website got admitted to the National Library of Medicine just about 3 months ago. It was considered something that's important enough to archive, so that just blew us away. It wasn't aiming for that, but it was affirming that we had done something that really mattered. And then from there, more and more and more patients that came saw me. I think that for whatever reason, we're just kind of kindred. I seem to understand people who are going through a gender journey. I understand what it is to be marginalized, um, and and they understand me as well. And so that has spiraled upward. And by 2015 to 2017, I wasn't doing any other types of surgery. I don't do a single cosmetic surgery any longer. It's impossible to get that sort of surgery by me. And it's been great ever since. So now here we are in 2024, and we now have 3.5 surgeons other than myself. And I couldn't be happier.
Wow, you said so many amazing things, and again, as a member of this community, I want to thank you for that intro that you just gave in that answer, because you hit on so many things that's important to us. When we walk into an office, when we make a phone call, or go into a consultation, we don't know what we don't know.
Yeah.
And we can only hope that the people on the other side have our best interest in mind, and that they are as committed to this process as we are. So hearing you say that this is something that aligned with your values and you felt this connection, that's really special to hear, because I know a lot of times we don't feel that. We don't have that connection. We don't feel safe walking into these spaces that are
Mhm.
made to help us out and help us feel like better versions of ourselves. And that is, it's so important to have that relationship going into it in order to make the process that much more positive, as
Yeah,
you go. So,
I really hear that, Slater. That's very
yeah.
consistent
Yeah.
with what
So how do you help your patients? You talked about being a kindred spirit. How do you help your patients prepare mentally and emotionally for surgery and the recovery process?
It's a great question. One of the great things about doing this work is that people come so pre-prepared. They are intelligent people who are detail focused, and they want to dig into a website. As a contrary example, you could have a cosmetic surgery website that digs into a great deal of depth about all procedures. No one will read it. Nobody
Yeah.
wants to know that stuff. When people are looking for a cosmetic breast augmentation, they just want the cosmetic breast augmentation. They don't bother me with the details. Just give me this magazine photo. But people on a gender journey are very, very interested in all the information because they are highly expansive and they know it, and they want to make decisions that are correct for themselves. And that is part of the gender journey, is getting to know who you are and what you want. And um, so people come to me pretty pre-prepared, Slater. They are smart and they know the answers to most of the information they already know most of the information that I can give them. But we still prepare them by satisfying that need. So a comprehensive set of information, sort of the everything you need to know. If you read all of this, you should be fine. And there is some information in there about, psychological and emotional preparedness for surgery. So you do expect after surgery that you're going to have some ups and downs. The human body, and actually all animal bodies, are actually built to shut themselves down after they've had an injury, and surgery is perceived physiologically as an injury. So after surgery, we're all kind of down. We're all kind of depressed. Um, and there's some things that you need to expect about those ups and downs. And so we have handouts along those lines. But I really find that just giving patients good quality information and assuring them that reading this will set them up for success is basically all that we need to do. So we're just briefly running down. That's about expectations for activity level following surgery, um, preparedness and diet around surgery and before surgery, um, and then a litany of common Q&As that have come up that they can benefit from.
Okay, awesome. And you said that people are coming to you now with a lot of information already, which is great, because what you said earlier was that there was not that much information out there in the
Mhm.
early 2000s, or there was a lot of misinformation out there. But are you finding now that the information that folks are coming to you with is accurate information, and you're not having to correct that or go back and clean things up? Does that make sense?
Yeah, it makes sense. And I think that is what's happening. So, in a couple of ways. One is just the raw base of information, even such as my body is this type of a body. This is what my chest looks like. I have this degree of looseness of skin. Therefore, these options are likely available to me.
Mhm.
So, that information is usually already present in a patient's mind by the time we start to talk about surgery, which is important because every surgery every top surgery, including augmentation top surgery, has considerable trade-offs. And so patients, if they've never thought about these trade-offs, it actually takes quite a long time to get somebody up to speed on really big trade-offs. But if they've actually thought about them a long period of time, it's almost just confirmatory. Okay, I do want flatness, so I can give up sensation. Or I definitely don't want flatness, and this is what I mean by that. Or this is how I describe non-binary, so these are the variations that I want you to make for my body type. Like, that would be a very challenging conversation if someone had never thought of those things. But
Yeah.
because virtually everybody now has, it actually is a very specific um, and quick affirming part of the consultation.
Right. Well, let me put myself in the minority, and I hope that I'm speaking
Sure.
for a couple of people here. So when I think about the potential of having this sort of gender affirming surgery and care, it's quite overwhelming because of the amount of information that's available for us online. And so sometimes I personally get to the point where I'm like, okay, I need to shut this down, or can I just watch a quick YouTube video? And like, is there a way you can wrap this in a bow for me? So I
Yeah.
know some things that are important to me. You mentioned sensation, right? And being able to hang on to that. So I know the things that are important to me, but I don't always know how to articulate and piece that together with what I want my results to be, if that makes sense. So
Yeah.
what advice would you give to someone like myself who knows, okay, this is something that I'm potentially thinking about, but there's a lot of information out there and I'm not quite sure where to go with all of this information?
So that's really great to hear. And even while you were talking, I wrote myself a note because I think we could build a tool for people that are like, I am, and honestly, I don't know if this happens to you, but when people face that sort of a daunting thing, it's almost like you dissociate when you
Yeah,
engage with
yeah,
it. Like you start to engage and then like everything becomes blurry and cloudy and you get tingles on your arms and legs and you're just like, I can't handle this right now, but maybe tomorrow when I'm better rested, I'll be able to.
exactly,
Yeah,
exactly.
right. Yeah. And so I think we could possibly build a tool that's not that big of a deal around this, right? Like a PDF that could be, hey, I am overwhelmed, but I think I probably want top surgery. Can you just
Mhm.
hold my hand and just literally walk me through this few important decisions that I need to make? Um, I would say that backing out of that vision and talking to you maybe directly, when I start a consultation, I always ask people a version of what are your goals, but usually it's what do I need to get correct as your surgeon? So when this
Mm,
is done and you're healed, what do I need to have done correctly for you to be super happy? And if
wow.
I can ask a question that way, then sometimes something will come up. It'll be either I have to maintain erotic sensation, or it'll be I've got to get clean and flat, or I need to have a masculine appearing, very, very muscular chest and the ability to train that into even further muscularity. So people usually actually know what they want if the question is phrased that way. And then that combined with a physical exam means this is the procedure type or types that can get us there. And these are the trade-offs that you're going to have to make if you're solving for this really important thing to you. And so it could be made actually quite simple. We do have a page on the website that's what surgery is for me, and it breaks down anatomy types, but I think we could even do better. I think we could make this so simple that it feels like somebody's just holding your hand and saying like, and also acknowledging the dissociation aspect of it and just saying like, listen, we're going to try and keep you out of that. And if we're successful together, you'll have moved forward this ball, you know?
Yeah. Yeah, hearing you ask those questions, like what are the goals for me? What do you need to get right? That's putting me in the driver's seat, and I can imagine someone coming into your office and having that feeling. That's part of the euphoria, right? Knowing that
Mm.
we're going to get that attention, that care, and be seen in that way. So that's great that that is your approach and the approach throughout your practice. All right, I have another question for you here, Doc. What has surprised you most about working with a transgender and non-binary patient throughout your career? And I know that's a broad question, but what's something that surprised you throughout your experience with the community?
Yeah, that's a great question. There's so many answers. I almost don't know which direction to go. But well, I'll start with maybe kind of like an easy one, and then because one that's to me very obvious, and then go from there. So one is just I was surprised that I enjoy it so much, and it's so easy for me to kind of identify with empathetically with my patients. It's
Mm,
really, really easy. I don't know why that is, but it's a real pleasant surprise. It's a real pleasant surprise to be serving somebody, able to do something for them, and you really feel what their lived experience is. As a comparative example, before I did this work, I had time to do more nonprofit work. And I had a medical mission group that flew around the world and did cleft lip and palate surgery. It was a small one that I founded myself. And we probably did 13 missions or so. And if you have, a child in front of you that has a cleft lip and when they smile, it opens up. So they look kind of like monstrous when they're at their happiest. And you look at their parents, and it is so easy to deeply empathize with what's going on there. It's so
mm,
easy to say, this must be corrected. And I'm going to do it. And I'm going to work all day and all night until this problem is solved. And so, that fortunately is a similar identification that sort of came for free. Um, as a matter of fact, I don't really understand how all the other practitioners in the country don't see it because it's so patently obvious when treating a trans individual, exactly what needs to be done and then what positive thing occurs as a result. It's deeply impactful. So that was a very pleasant surprise. Um, I was surprised at how consistent that is too. How consistent the im impact was and how persistent it was. When I started this work, like many people who are ignorant to the gender journey, I wasn't 100% sure what it was all about. And I still embraced it and I still treated everyone that came my way, but I was wondering whether or not in 5 more years, there might be some people that were angry with me for performing an irreversible surgery. And that I probably done, more than 2,000 surgeries, and I probably have maybe one or two patients that's angry with me for that reason. There's probably 3 to 5 more that are not at all angry. They just had a gender journey and transition and retransition was part of that journey. But the vast, vast, vast majority, we're talking like almost 2,000 other people come back to me with deep appreciation years later, having come into their own. I know everyone knows this who's in the audience, but that was one of the pleasantly, I don't know if it was surprising, but affirming things that I experienced was this work is so deeply needed and so consistently well received and so consistently powerful, um, that again, that just spun the flywheel faster and faster of my desire to be involved with this care.
yeah, yeah. And I love the way you talk about it and the normalcy that you bring to it, right? It's a
Mhm.
no-brainer. Um, and not but and there are layers to it. So if I can, I want to ask you about the different types because
Mhm.
there are several different types of surgery you can get. So
Sure.
what kind of top surgeries are there now, and how do you determine who gets what kind?
Sure. So yeah, so again, the maybe big pieces here are there's going to be trade-offs. Those trade-offs are considerable, even if it's just scarring, or maybe loss of some sensation. But those trade-offs are considerable. So you need to learn what somebody's goals are, what they really need to have happen, and what they're willing to let go of in order for that thing to happen. And then you need to compare it with their anatomy. In the anatomy world, a lot of that is whether there's excess skin. So for chest reduction top surgery, that means if there's even a little bit of overhang. If skin touches skin, then that is a situation where you're going to have to cut some skin out. There's going to have to be horizontal scars.
Yeah.
If that doesn't happen, and there's not a lot of extra skin, there's no angle and fold and overhang in the lower chest, you have some options available to you for maybe minimizing that scar. Maybe you could go for a tiny scar just along the border of the areola, which is the smallest scar possible. Maybe you could have a scar that's all the way around the areola that allows us to remove a small amount of skin and tissue. So the anatomy of an individual determines what incisions are needed,
Okay.
and then the priorities of that individual, mainly sensation, desire to have leftover volume, perhaps like a dad bod or a very small breasted chest if they want something that looks like an identifiable breast. Um, and um, and then so is volume, incisions, and then sensation are kind of and then I guess non-binary considerations. Those would be the things that one needs to know about oneself in order for it to hone in on. These are probably the surgeries. So the surgeries haven't changed that much over the years, maybe a bit. There's a double incision, which everybody knows about. It's the classic, flat making procedure where the chest can get, we don't want it to be hyper flat or concave, but appropriately flat and balanced. And that involves a skin graft that's then the areola is cut as a circle and off the body and thinned out and then placed as a skin graft on the chest. We talked about minimal incision approaches. Those are called peri and keyhole surgeries. Um, and then there's some non-binary options out there, which really ultimately demonstrate neither a classic male nor a classic female result. Those are surgeries that are hard to describe with words, but something like a fish mouth type of a procedure, and all this is on the website, or a buttonhole or inverted T that might leave some tissue behind. These would be like, leaving a mound of tissue types of surgeries. Slater, I don't think I organized that information very well when I was describing it
No,
to you.
no,
I'm sorry,
no, but
but
that's okay. That's okay.
yeah,
I'm following, and for everyone who's listening out here, if you have questions coming up as Dr. Monster is speaking, please put them in the Q&A, and we'll get to them in just a little bit. But one of the reasons why I asked you that question, Doc, is because there are many people like myself who bind right now, and when we think about what that will look like, having surgery versus binding, and what are the outcomes, it's just one of those things with information overload, right? Like,
mhm.
what are the options? But it sounds like you're saying it's individualized, your anatomy, your particular body, and what you want your outcomes to be, and then you kind of take it from there. Is that
Yeah,
correct?
and you may not even need to use words. Like if someone I'll use you as a hypothetical. So
Sure.
if you came to the office and you said, honestly, I really have a hard time putting this into words, and I find it all overwhelming, but here's 10 photos of chests that I really like, of
Mm,
people that have a body that's something similar to mine. So that
yeah.
could be cis or trans, it could be pre or post-op, it doesn't matter. You put 10 photos there. An experienced surgeon will be able to see the through line of what you're solving for. And sometimes it's a very, very tight and specific signal, such as they all look like super masculine, super cut chests with lots of muscle. It's
Mhm.
pretty obvious what somebody is solving for. And other individuals, it might be, again, people that have like kind of a dad bod, a bit of fullness on top, and then that's the consistent thing. Other people will seek and find very, very non-binary results. And then once again, the story tells itself. So that collection of photos plus the anatomy photos that are sent in to a gender surgeon will be enough for an experienced gender surgeon to say, I think I see the story here of what we're going for. Let me repeat back to you what it is that I'm seeing. And then that will either resonate with you or it will not.
Mhm.
Um,
Yeah,
yeah,
totally makes sense. If we can stick with this whole journey of surgery, can we chat a bit about what it looks like post-op and
sure.
what that aftercare is like, what that process is like? Because not having it, but I've had my own clients, being a personal trainer, who have come to me and said, I'm out for 6 to 8 weeks, I'm restricted. but it also messes, well, not it also affects them mentally along with physically. Can you just talk about
I
the
can,
different
yeah.
aspects of post-op?
Sure. I'll talk about the milestones. I'll kind of actually
Yeah,
tell you,
that's great.
Slater, the stuff that I tell people during a consultation and kind of like the longer version, just a little bit here. So right after surgery, um, generally there certainly is some soreness, but it's usually less than patients were expecting. And I'll briefly depart from the description because I want to tell you how interesting this is, Slater. Humans that have a mastectomy surgery for the reason of breast cancer, so generally cis women that have it as a result of breast cancer diagnosis, they have a very similar surgery and they are miserable with pain. Probably because there's a huge fear component. They've been treated for cancer and they've had something happen that they didn't want to happen, which is the removal of their breasts. Something about trans individuals, they have a fraction of the pain that cis people have for the exact same surgery. I think it's probably the fear-based situation in the first circumstance and the incredible optimism and resolution of suffering in the second circumstance that then modifies deeply the perception of pain. So, having said that, back to the after surgery milestones. It's about a 3 to a 5 on a scale of 1 to 10 for discomfort for most people. So there's some soreness. It's not excruciating. And then everybody's all kind of tucked in with their dressings and stuff after surgery. They might have drains, they might not have drains. Some practices use drains, some don't. I actually don't think it's that big of a deal for that might not even be worthy of discussion. But bottom line is probably drains are helpful in some people. Um, and then they are up and around after surgery and probably emptying the little drains and the fluid that goes into a little medicine cup they can read the number on and they write down that number. And then they'll come back into the office at 6 days after surgery. This whole time, they're really not supposed to be lifting more than 5 pounds, and they're not supposed to be exerting themselves, though they can walk as long and as far as they want, as long as you'd consider it to be a very casual and slow stroll. At 6 days after surgery, they'll come back into our office and we'll take all the dressings down and we'll look at everything together. At that point, if they've come in from far, they can go home and we write them TSA letters to get through airport without having to raise their arms.
Hmm.
At 3 weeks after surgery, back home, they can go from lifting no more than 5 pounds to now lifting up to 25 pounds.
Oh,
And they
wow.
also can go back to cardio. So running and cycling, they can actually get back to exercise. They can begin to ramp up the lifting of their elbows over their heads a little bit to the point that at 6 weeks after surgery, they should be able to put things on high shelves without that being a problem. I want to call out that I contributed to misinformation here because when I first started doing the surgery, I told people they could not raise their elbows above their shoulders, so above here. I told them wrongly. They couldn't do that exactly, that or above, for 6 months after surgery. I was
Wow, that's a long
wrong.
time.
I was wrong. And I thought that the wide scars I was seeing in other surgeons' work was a result of this arm position. The wide scars were because those surgeons happened to be closing people too tight, not because of arm position. So at
Wow.
6 weeks, I let people put their arms over their shoulders. It's no longer a thing. And as a penance for my sins, I've worked with a PhD physical therapist to create a full rehab regimen based around shoulder mobility. And that's available through our office and it's available as a scannable code in all of our patient rooms. For patients that have very, very high arm position, now they may be exceptions. So those people that are maybe circus aerialists or freestyle swimmers or rock climbers, now they may need to wait a little bit longer, but usually not any longer than 3 months after surgery, with everybody listening to their body as to, if it hurts, don't do it, basically.
Yeah, yeah.
So those are basically the milestones after surgery. You don't need anybody to be with you technically, you don't need anybody to be with you more than 24 hours after surgery. But the truth of the matter is, it's really nice to have somebody who is supportive and contributory um, after surgery. So I highly recommend a solid support system, even if it's just somebody that can physically be with you and keep you company. It's just a bummer to recover when there's nobody around. It sort of amplifies the aloneness of someone not being around. It's even worse, of course, if you have a negative energy person or somebody who is judging you who's there in your recovery, because again, it amplifies your vulnerability to somebody else's input is vastly amplified in that period. So it's not a requirement, but I highly recommend that ready access to one support system is available for at least the first 7 days, but intermittently so up to 21 days after surgery.
Yeah, and that's great advice. Thank you for that. That's something to think about prior to surgery, right?
Mm-hmm.
Who's going to be there to support you? Hopefully, we have our circle already in place, but really, who's going to bring that positive energy? Because we will already be in our own heads and going through this, you said scale 3 to 5-ish on the discomfort level, but our bodies will be going through a lot of changes. And so the
Mm-hmm.
more positivity we can surround ourselves with, the better the healing process is. It sounds like you're saying. Yeah,
Yeah,
which is
also
super
very true.
important. Yeah.
Yeah.
All right, awesome. Well, I want to ask you one more question, and then I'm going to actually send it back to Aiden for a bit. But this last question here that I want to ask is, what advice do you have for someone who might be considering top surgery but is still unsure about taking the next step?
Yeah, so you could always do a consult with anybody who is highly, highly experienced. So I would say somebody who's like basically only does gender surgery. And they're very likely going to approach you and help you articulate whether this is right for you. You could certainly work with a therapist if there is one on your gender journey. Um, but also what I mentioned to you has value, which is you can just simply create a list of like, hey, if I had top surgery and it gave me this, 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 and this concrete physical outcome, um, does that seem like something worth pursuing? Even if there may be some trade-offs associated with it. And if that's a resounding yes, then it's probably worth getting more information.
Yeah. Awesome. Thank you. All right. So thank you so much, Dr.
My
Mosser.
pleasure.
Great chat and great insight. I really appreciate that. And again, if you guys have any questions, drop them into the chat right now or drop them to the Q&A section. I'm going to pass it back over to Aiden for the next few minutes before we jump into those questions. So Aiden, back over to you.
Awesome. Thank you so much, Dr. Mosser and Slater. And to repeat what Slater said, if you have any questions, please drop them into the chat right now, or you can drop them into the Q&A section below. Before we begin questions, however, if you do feel inspired by today's conversation, there we go, dropping it in the chat, we encourage you to make a donation to Point of Pride. Your support allows us to continue providing free gender-affirming services like binders, gaps, HRT access, and open currently our annual trans surgery fund. You can donate at the link I just dropped in the chat, or you can text one word trans futures to 44321. Every contribution makes a difference. So now I'm going to send this over to you, Slater, and I will do my best to get you these questions. However, I can't seem to copy and paste them into the chat. Can you see the Q&A,
Yeah,
Slater?
no worries here. So we will tag team this here. And as a reminder, for all you folks out there, put them into the chat, put them into the Q&A, and we will do our best to get to all of the questions that we can here. So I'm going to start with some that I see in the Q&A, and I'm going to work my way backwards. So Doc, do you have any suggestions for minimizing comfort in the early days after surgery? Stuff like pillows, etc. Will there be any problem cleaning up after going to the bathroom?
That's such a great question. You know, that question is coming up more and more often, which I think means it must be making its rounds on the chat room. So what I will say is, for whatever reason, patients don't tell me about trouble going to the bathroom, but I have to assume that that's going on. So basically, we're talking about wiping yourself. And the specific difficulty is getting your hand behind yourself because there's some limited chest movement. And I think that that can sort of be a thing. Usually, people moving slow and just kind of, respecting their body's discomfort can get themselves clean without too much trouble. I will say if somebody has the luxury of a bidet type toilet seat, all the better. That is really helpful. And when you think about the costs associated with healthcare and the fact that these things only cost, yeah, wet wipes, certainly I see that comment made. Yeah, wet wipes can be super helpful. But yeah, it might be time to invest in a economical bidet toilet seat. That'll work wonders and serve you for years to come.
All right. And someone else said, "Hi, I'm late." You're not late. You're here on time. Is BMI a factor for most surgeons for top surgery or no?
Great question. So it's a bit of a long answer, but I'll say the short version and then the longer version. In our practice, no, it's not. For surgical healing, there's basically no restrictions on BMI. Having said that, beyond certain higher BMIs, like upper 50s to 60s and higher, some anesthesiologists will unfortunately not put patients to sleep. I disagree with this practice because they would put patients to sleep for something else that's reconstructive, like a hip fracture repair or a broken nose or something that just simply needed to be done. So I think that the medical community has a bit of growth that's needed. Um, but surgically, in other words, will the chest heal? There is no limit on BMI for the surgeon's decision to move forward with surgery.
All right, thank you. Next question for you, Doc. Would taping with trans tape reduce skin elasticity and decrease chances of eligibility for keyhole or pairing?
It might, but it's really hard to say. So I will say that, the truth of the matter is it's tough to live with something on your chest that you don't want and is constantly intrusive for a number of reasons. Trans tape and binding are things that can reduce considerable amounts of gender dysphoria. Yes, especially especially if the chest tissue is being taped downward and there may be inducing some overhang, you could push yourself over the boundary and no longer be a candidate for peri. But one has to live in the real world, and sometimes the balance is on just getting what you need to get through the next several months or years in order to get to surgery. And sometimes that means binding and using trans tape.
Yeah, gotcha. All righty, a couple more for you here, Doc. What type of letters do doctors need, and what kind of info should be in them? Any specific kind of doctors to get them from?
Great question. We, as a practice, do not require any letters for top surgery for any adults. Now, I will say that almost all insurance companies do require letters. So we end up having letters for the vast majority of patients because most patients get surgery through insurance. We have a template. Our team has a template of a therapist letter that covers the vast majority of what's needed for successful insurance approval. So if anybody needs this, just have them reach out to our office or our team or send us something through our website. The individual that will be writing the letter is generally a mental health provider. So it can be anyone from, master's in family therapy or licensed clinical social worker who's doing mental health, all the way up to PhD or MD psychologist or psychiatrist. And some insurance companies will have a problem with someone who doesn't have a doctoral degree doing the letter, but most insurance companies will be fine with any licensed mental health therapist writing the letter.
Okay, got it. Thank you. And also, everyone, be mindful we have the links going on in the chat there, so you can click on those. Next question for you, Doc. Suggestions for being comfortable after surgery, any common issues, solutions?
Yeah, again, we have a robust packet that we would be happy to send anybody. They don't have to be going to the GCC for surgery, and we can give them things. There's things like a comfort station, wet wipes is in there. There's a number of things that you can just have on hand that could be helpful after surgery. I think a lot of the comforts are just creature comforts, meaning it's not, you're not on such a razor's edge for being miserable with pain that you have to do everything just right or you'll be in pain. That's not the case with this surgery. This surgery is a surgery where you're sore. So a lot of the comforts are, do you have good food? Do you have to walk up and down 2 flights of stairs to get the simple thing that you need? Or did you have the forethought to put it all in one place so you don't have to move around a lot? And do you have good people around you that are supporting you? That'll go a long ways to addressing comfort, though we're not really talking about, surgical operative site discomfort.
Sure. What are some of the most common trade-offs that you mentioned?
Yeah. So scarring, big. Reduction in areola sensation, nipple and areola sensation is very common. Not true with all surgery types, but certainly true with many. Um, and possibility of, the need for revision surgeries. So if you're not I don't know how to put this into a soundbite, but if you're not aggressive enough, if you have a lot of skin or a lot of skin along the sides and you don't address and remove that skin, then that could lead to a need for a secondary surgery. That could be, considered a trade-off. But a lot of it is not all surgeries get you flat. Some surgeries reduce erotic sensation to normal sensation or even less. And certainly scarring is a component of all skin removal procedures, and many of these are skin removal procedures.
Gotcha. And I actually want to ask a follow-up to that question. What is the percentage of those secondary surgeries?
Oh,
Like
it's minimal,
how,
fortunately.
yeah.
I can't speak for other practices. I have heard, but don't have any solid numbers, that some people quote 25 to 30% revision rate. That's what that means, a secondary surgery. We don't see anything close to that in our practice, so I don't know where those numbers come from, but it's generally about 4% or so of patients will need some sort of a revision of the patients that I treat, about 4 in 100.
That that's a huge
Yeah,
for
I
yeah.
don't not sure what who knows, maybe it's different body types. I can't speak, but in our I can tell you our experience is about 4 to 5%.
Gotcha. All righty. Next question for you. Any advice for the night before surgery? What about driving home afterwards?
hmm
We have this person is saying that they have a long drive home after their surgery.
Yeah, well, I'll tell you only what our practice recommends, which might be different from what other people's practice recommends. So the night before surgery, you should have a very robust set of instructions that is crystal clear, and that would be provided for our patients. And some of that says nothing at all to eat or drink after midnight. Sometimes there are allowances for taking their own pills in the morning, but generally speaking, certainly no meals, no food after midnight the night before surgery. And then there was a second part to that question. There was before the night before surgery, and forgive me, what was the other part of that?
And then driving home after
Oh, driving home.
surgery.
So if you are driving, again, in our practice, if you're driving more than an hour, especially more than 3 hours, we recommend sticking around. I would say that it's a good idea to at least stick around until the following day at some hotel in case something were to happen, some sort of a minor bleeding issue that needed attention in an emergency room or something. And then the following day, one could, drive further away. It's probably no surprise that you can't actually drive yourself for 24 hours after surgery or anytime you're taking controlled substances for pain control. That even though that's a doctor prescribed substance, it still would be considered a DUI if you were behind the wheel.
And this may be a silly follow-up to that, but something that popped up for me is what about flying? Are there people who they have this procedure and then they fly out? Is that recommended? And can people do that?
Most people don't. It can occur. There's the occasional individual who really, really doesn't have resources to stick around in San Francisco. And we have a pretty long conversation about, like, hey, if something goes wrong and you're in San Diego, like, you're going to have another surgeon who may not be very gender competent taking care of you. So the overwhelming recommendation is please try and stick around if you possibly can. But after an extensive risk and benefit discussion, if somebody says, I absolutely cannot, and here's why, but especially if they say something like, hey, everyone in my family is a nurse, everybody knows what to look for, then I get a little bit more comfortable and they actually could leave, usually not the same day, but possibly the following day. But again, most people will stick around for that 6 day visit after surgery.
Got it.
Overwhelming
Okay.
majority.
Gotcha. Alrighty, here is another one for you. What steps can we take to ensure gender affirming surgery remains available in the future? Should patients be concerned about having access in the coming years?
Yeah, that's a really great question. Now, I hope I'm not going out on a limb because I'm very optimistic. I know that the world can be very scary right now, and there's a lot, and somehow gender got thrust into the middle of the political argument. But I will say that at least there are sanctuary states where gender care is available widely. And so that is very, very different from the way that it was in 2010 and 2012. Back then, there wasn't even an acceptance at all that any of this was real in any way, shape, or form. So it feels hard to think, oh, we've taken some steps forward, but I actually think we've taken some steps considerably forward because now they're aligned along battle lines. But the big picture battle of is this real and is this valid is starting to make its way into the common vernacular. So that would be my response to that. I don't think this is going away. I also think that I mean, nobody wants to wait, but all we have to do is wait because the younger generation is going to get older, and nearly 100% of the younger generation individuals are fully embracing of a gender expansive journey, and they're going to vote before too long.
Yeah, yeah. Thank you for that glimmer of hope there. Best ways to determine a good surgeon for the surgery we are looking for?
You would, a couple of things in the short time that's available to us. I would say, A, they're really super serious about gender surgery. So they do a lot of it. Hopefully they educate people or they go to big national conferences. They're serious about exchanging ideas with other surgeons and staying at the forefront. And also, you just like them. You think that they're not this black box of knowledge that you have no access to, but they're a consultant that partners with you with their knowledge and tells you things that make sense and seem to listen to and respond to your questions in a reasonable way.
Right. And I want to ask you one more question. We have so many questions coming in. They're all so awesome, but I can only pick one more to go with. So I'm just going to go with what's right in front of me here. Is it okay to just bind for now, and then when my breasts start to sag, can I get rid of them, or is it important to do a major surgery like this while I'm younger?
As long as a person is willing to have the trade-off of a scar, none of that matters. If you're trying to minimize scars, there may be a component of trying to get it done before the skin elasticity has taken a hit until you've lost some skin elasticity. But if somebody has already made peace with the scars, and I mean like the horizontal incision scars of the lower chest, if that's acceptable, you can always get a flat chest. There is no chest that's too big for us to be able to achieve a flat chest with that trade-off being acceptable.
Awesome. Well, thank you for answering all of those
Yeah.
Spitfire questions, Doc. And I want to send it back over to Aiden.
Hey everyone. Thank you so much, Slater, for hosting. Dr. Mosser, thank you so much. It's been a great event. We got to so many questions. I'm so sorry that we would be here all day if we took all of the questions. So thank you everyone who asked those questions. And also just thank you all for your attendance today. If you'd like to stay connected, with Dr. Mosser, I dropped some information in the chat as well as Slater. So if you want to check out their offerings as well. We'll also have this event on replay on our blog, which will also include all of the information that was shared today. And maybe Dr. Mosser, you can send me some of those resources. We'd be happy to add them up as well. But all in all, available on the website, the GCC website. I encourage you all to stay connected with Point of Pride by following us on social media at Point of Pride ORG, and definitely subscribe to our newsletter to get information about all of our programs and when they open for applications, like our annual surgery fund, which is open right now. Remember, if you would like to support our work, donations can be made by texting Trans Futures to 44321. Before you all leave here tonight, I want to remind you of our other programming that's happening to kind of close off Trans Awareness Week tomorrow. We'll be hosting a facial feminization surgery fireside chat with Dr. Spiegel at 4 p.m. Eastern. Again, we will have all of our events on replay on our blog at pointofpride.org. Thank you again so much to our ASL interpreters. Slater, you're the best. Dr. Masser, you're the best. We appreciate you here, and I hope that you enjoy the rest of your evening.
Thank you all so much. I appreciate it.
Thanks.
care.
Bye, everyone.